So the MOST study is a very important trial looking at patients with essential thrombocythemia, one of the myeloproliferative neoplasms. And as part of that effort, we want to kind of look at the cusp between myelofibrosis and essential thrombocythemia. We make these bins artificially, right? These diagnostic bins. Oh, if you have such criteria, you have such disease. But in reality, these diseases are on a spectrum, right? All the MPNs that are driven by JAK-STAT mutations it's really a smear of disease. But again, these bins that we've created to make diagnoses are very artificial. And we want to understand kind of the way patients flow from one diagnosis to the other and look at those patients that are on the cusp. And one of those cusps in the interfaces between diagnoses is the interface between ET and myelofibrosis. And in recent years, we've had the addition of pre-fibrotic myelofibrosis, which better defines that space between the two diseases. And with this part of the MOST study, we wanted to see how patients with low-risk myelofibrosis might transition to higher risk. Again, kind of on that more aggressive end of ET, if you will. And watch the rate of progression, because it might inform us also too, looking downstream a little or upstream a little, if you will, how patients with pre-fibrotic myelofibrosis may progress, or even ET may progress into myelofibrosis, to better understand that spectrum of disease. So most of the prospective observational study, enrolling about 2,000 patients with ET and about 500 patients with low risk, kind of early stage myelofibrosis, to look at these kind of transitions over time. And what we found is that patients with low risk myelofibrosis, although they have a very favorable survival compared to high risk, do progress. And kind of subjectively looking at the results, to me, it's impressive about some patients who progress early, while others are quite stable. And really, it almost seems like there's two trajectories for disease almost. Whether that's something that, it's a very aggressive disease we just happen to catch early, so we're calling it early myelofibrosis, or that truly indolent form of disease. And I think that's really important as we hammer down into this data more and start looking at the molecular markers and biologic correlates to understand what's really driving that aggressive disease versus the less aggressive disease. Again, at the outset of the study, all these patients had low risk myelofibrosis. And why did these group of people shoot off like a rocket, and these other folks' disease kind of just muttered along like the tortoise, and so really kind of understanding why, the biology behind that with the samples that were collected in this study, will be so critically important as we go forward.